Speaking of brains and headaches, neck aches, ear and facial pain. Seriously now, so many people experience these symptoms and they don't know the cause. I want you to welcome back Dr. Dwayne Keller from Keller Professional. Today we're going to talk about pain, where it comes from, how you can treat it, and what your options might be. And in your office, in your practice, you really work with the patient to manage the pain in unique ways sometimes.
Correct. What we found is that most often it's a combination of form and function. Most pain comes from muscles. Muscles cross joints in most instances. What we try to do with or deal with is the change in form and improving function. What I use in my office is a little thing called an orthotic. It's a little appliance. It changes how the bite moves, how the jaw joint changes, which also will change how your neck moves, because there's two ways to move your jaw. One's this way, the other is I can rotate my head on my neck. So if you have a problem here, you have a problem here. So we start by changing the form. Then I have 3 physical therapists in the office, and they then work with the muscles and improve the muscle function with deep heat, massage. Sometimes you get little knots in muscles called trigger points, try to get those back. Then as they improve the function, we change the form. And then we work on that over a couple of weeks until we get the patients back to the best position we can. And then we leave them there for a couple of months to be sure that they're going to be stable.
Now see, and what my concern is that when we say to you at home and talk about jaw, that people are thinking, well, I don't have pain in my jaw. My pain is in my neck, or my pain is way behind me, or up in my head, or someplace else in our body. But like you said, those nerves run through those areas, and that pain can be, we can feel the pain in other areas, but it's actually being caused by that dislocation, I'm going to call it.
We deal mostly with what we call upper quadrant pain, from about the shoulder blades up. That's the general genre of what we're dealing with.
But my point is, it's not necessarily just in the jaw.
No.
So that's why
Correct.
some of your patients are amazed that that's where the pain was coming from to begin with, because they don't feel the pain there.
Correct.
So I've heard, I'm going to go off track a little bit, because I've heard about people that use Botox to treat pain. I mean, we've all heard of the cosmetic aspect of it.
Right.
But they use it to treat pain, is that right?
Well, Botox basically interrupts the nerve muscle fibers. So yes, you're going to stop pain, but I think the real question is, why is the muscle in pain in the first place? Do you want to treat the effects, or do you want to treat the cause of it? What I think a lot of people don't realize is what Botox does to the muscles. There's an article by Fortuna that was published in the Journal of Biometrics that shows that if I inject Botox in my bicep, I'm going to reduce 88 to 95% of that muscle strength, but I'm going to lose about 50% of that muscle mass.
And it never comes back, right?
It doesn't come back. And what's going to happen is my tricep, now because it's now working against a weaker muscle, it loses strength.
Okay.
50% of its strength, and then it loses its muscle mass. What's important, 3 to 6 months, I've lost 68 to 80% of my muscle mass.
That's huge. And not only that, but you're only treating the symptom by deadening that. You're not going to the root of the problem.
Right. Why was this muscle in pain? Do I really want to reduce the muscle, or do I want to find out why that muscle's in pain and treat the cause?
Right. And that's the kind of options and the kind of unique approach that Dr. Keller takes in his practice. If you're experiencing these kinds of problems, discuss them with your dentist or your doctor, or call Dr. Keller at 314-638-4190. They'll help you find out why you have pain and what can be done. Or you can always check out Dr. Keller's website, drdwaynekeller.com, to learn more about TMJ. And someday we'll just talk about just TMJ, and because I know that, I mean, everything that you do is so far-reaching, and the options are so numerous in many cases.
And that's because it's so multifaceted.
Yeah. Thank you, Dr. Keller. Appreciate it.
It's so life-changing. Thank you, guys.